Hi everyone, hope you're all doing well. Just wanted to go over some items from last week and then look at our week to come as well. So last week, let's go in here. Last week we talked a little bit about torts, malpractice, all sorts of various kind of basic aspects of law in the healthcare setting. We also specifically talked about the issue faced by the nurse at Vanderbilt, so some specific work on that. We had our professional responsibility, or professional and personal responsibility discussion as well in our Flipgrid. And then obviously here's our group assignment. I will remind everybody if you are if you and you probably already received a notification this morning, everyone needs to complete the self and peer assessment, which is found right here underneath the assignment. You may have had someone in your group that submitted the actual your PowerPoint slides for that particular case, but everyone needs to submit their own self and peer assessment. So please do so, and sorry about that. Please do so, and then I'm able to proceed with grading in that as well. And then we also had our quiz. So let's take a look at our quiz information here. So here we go. Several states have modified. I apologize for the bouncing C in the bottom here. Let me just do this quick, and then I don't have to worry about it anymore. Okay, several states have modified the collateral source rule in order to. So the collateral source rule generally stated that there's a kind of a doctrine with regard to collateral sources, and what it said was that courts or within a single malpractice action, the court could not look at monies that the plaintiff may have been receiving from other sources. So, perhaps their health insurance, or perhaps, other types of insurance that they had, maybe like AFLAC or those types of things. Or maybe they had a different lawsuit suing someone else involved in the case. So, what the collateral source doctrine originally stated was that the court could only look at what they received. They couldn't have access to that other evidence that showed that although the patient was claiming $100,000 in medical bills, they had already received payment in the, maybe in the amount of $80,000 for those. So they were technically only, they were only able to obtain, or only should be able to obtain, another $20,000. The rule prohibited those types of situations. So what states are doing, they're modifying that collateral source rule to allow access to those types of things. So again, let's say there's a $100,000 medical bill. Patient's health insurance has paid $80,000 of that. In that case, the court would be able to offer just a $20,000 payment on that, because the rest of it's already been paid. There obviously are huge issues related to malpractice actions and the massive settlements that come from them. So this is kind of in relation to that, to try and decrease those settlements, and it's all part of tort reform, which we reviewed this past week. Next question. A/Ann. Blank is the intentional touching of another's person in a socially impermissible manner without that person's consent. So of our answers there, slander, battery, fraud, and assault. Our answer is battery. So remember, and there's discussion about it in the textbook. I think also I posted slides. I think I posted the slides in the classroom. When we look at assault and battery, it's oftentimes confused. Assault is a credible threat of some sort of impermissible touching. So the example I always use is Dr. Hampy's office is right across from mine in Scaife Hall. And if I were to go into Dr. Hampy's office and say, hey, Dr. Hampy, I'm going to punch you in the nose, that would be assault, because I would be a credible threat. I am an adult. She is an adult. If I threaten her, that would be considered assault. I don't actually have to touch her for it to be assault. If I were to threaten her and then punch her in the nose, that would be assault and battery. However, if we had someone that brought in a small child, maybe a 2-year-old, to the office, and that 2-year-old walked into Dr. Hampy's office and said, I'm going to punch you in the nose, that is not a credible threat. It's highly unlikely that the 2-year-old is going to be able to punch and hurt an adult woman in that case. So that would not be considered assault because it is not credible. If the child did somehow, attempt and actually injure Dr. Hampy in some way, then that could be considered battery. But assault is the threat. And it needs to be a credible threat. Battery is the actual act of intentional touching of someone else in a way that that person isn't consenting to. And why do we talk about this in healthcare? If you operate on a patient and that patient has not signed an informed consent form, that is battery. And we have issues with that frequently, unfortunately, if all of the appropriate steps are not in place. So that's why we talk about it here, but trying to understand the difference between assault and battery, kind of think about that more simple context. Assault is a threat. Battery is the actual battering of someone else or hitting them, or doing whatever, doing that intentional touching that is inappropriate. Voluntary exposure to such risks as radiation and chemotherapy treatment is known as. So of the 4 answers there, our answer is assumption of a risk. Again, kind of going back here to assault and battery, the way that we don't commit assault or battery is by having our patients have informed consent. And the same thing applies here. Patients know that radiation and chemotherapy can be risky treatments, especially radiation. The radiation treatments may help the patient to resolve whatever issues they have going on, but it may cause other injury. And what will always happen is the provider will have a discussion with the patient and they'll talk about risk versus benefit. And if the benefits don't outweigh the risks, they likely will not proceed with the treatment. But even if they do proceed with the treatment, knowing that the benefits outweigh the risks, the patient is still assuming that risk. And it is voluntary on their part, and they need to sign informed consent as such to explain that to the provider that they understand that. So assumption of a risk, negligence, cause, innocence, those are not part of this discussion, but that those types of exposures would be assumption of risk. And that's it. So let's hop back over the classroom quick. So in week 3, we're going to talk a little about HIPAA, so one of my other favorite topics. So looking, we have some information in the textbook. We're also going to talk about some different types of data breaches, some privacy breaches. There's a fact sheet from the Center for Medicare and Medicaid Services, and we've got a few handy-dandy videos. Our discussion board this week is going to be a traditional written discussion board, not a Flipgrid discussion board. So, I've shared, actually I didn't update that, I apologize. I've shared some of the leading incidents within the last couple of years. I'll go in and update that. So what I want you to do is go out and find your own HIPAA privacy or security breach and share that information in the classroom. And then in your discussion back and forth with one another, think about and talk about what the provider or the organization, the facility, whatever it might be, how could they have avoided this situation and what can they do to avoid that situation in the future. So that's our discussion board this week. We have a written assignment, which is there's kind of 4 facts, and what I want you to do is do a detailed analysis of those facts. And kind of think about it from fact to fact to fact. So, okay, you're making your analysis based on what you know in fact 1. And then when you get to fact 2, you're making an analysis based on what you know in 1 and 2. And then continue that forward until you get to fact 4. So again, that's focused on HIPAA privacy, security, breach notification, etc. And we have our quiz and our Edpuzzle. So that's all I've got. If you have any questions, please feel free to reach out. I think there was something else I was going to share with you all. I talked about the self and peer assessment. For your Edpuzzles, you don't need to upload anything to the classroom. I mean, you can, but you don't. For the Edpuzzles, you don't need to upload anything to the classroom. Just complete the Edpuzzle in the right in Edpuzzle, and then I go out each week and pull those grades over. So don't feel like you need to have anything uploaded to Blackboard for Edpuzzle. I will grab that. Same with Flipgrid. When we're using this week, we're not using it, but when we're using Flipgrid, you don't have to do anything in the Blackboard classroom. Just work in that separate environment, and then I go out and pull all of that information. So that's all I've got. Any questions? Please let me know. Thanks.